I'm Tamara, and this is TELUS Talks with Tamara Taggart. We're bringing together experts, thinkers, and leaders, busting myths, sharing stories, and staying connected when Canadians need it the most. We're having unexpected conversations for unprecedented times. Hi, Joy. How are you doing?
I'm great. Thanks. How are you doing?
I'm really good. I'm excited to talk to you about nonprofits and navigating through this worldwide pandemic. This is really hard for a lot of people, but there is definitely a group of people who rely on nonprofits and rely on the help of others, and I'm sure that this for you and for your organization, the Alex, this has proven to be challenging.
I would say that this is probably one of the most challenging things that me personally have ever been involved in. I've done a lot of heavy lifting with a lot of big projects over the years, but nothing to the magnitude of the pandemic of COVID has caused us all to be thinking about. This is something that's happened throughout the entire world. We've got nothing to look at as best practice, gold standard, guidelines or protocols from any place else. And so we're all trying to figure it out for the best possible way forward and doing it in real time and ensuring that at the Alex, we've never closed our doors. We continually kept our doors open, and we've pivoted and been nimble and on the fly. And there's been a lot of tense moments and a lot of stress and anxiety from our staff. The staff at the Alex, they're some of the best humans I've ever worked with on the entire planet ever. They give each and every day when they come to work, the work that they do, regardless of what role they're in. They take it so seriously, and they're so committed to ensuring that each and every person that comes into contact with us at the Alex has the services and supports that they need on any given day.
So you are in Calgary.
Yes, we are.
And for people that are listening that aren't familiar with the Alex, the Alex has been supporting vulnerable Calgarians since 1973, right?
Mm-hmm, yes.
And every city, every major city at least, probably has a place like the Alex in it, and your services are vital, really, for a large number of people. So can you give us a couple of examples of things that the Alex would do outside, like before this pandemic? Like, what are some of the services?
So pre-COVID, what I can say is so we're a community health center, and we're actually one of the largest community health centers across the country. And so we offer a real array of services. What we're most known for is our healthcare services, and it's our healthcare services for the vulnerable sector. So we have on our main site 3 healthcare clinics, one for our youth. So we have a robust, large youth clinic. It's the largest youth health clinic in all of Calgary. We see over 5,000 individual youth every day, and they come to us for their health needs as well as their social and wellness needs. Mm-hmm. We also have a community health clinic at our main site, and that's for folks over the age of 25. And so they also come to us for everything from complex health issues, mental health issues, addictions, as well as social and wellness supports and resources. And then we have a housing clinic. So those are our folks that at the Alex, we also support 450 people on any given day who have experienced homelessness. And so we support them through a housing first model. We have 2 buildings that individuals live in. One is more like a group care setting, and another is individuals living in apartments. And then the rest of the folks that we support are living in what we call scattered housing sites, so either an apartment or a basement suite. And so a team of our staff will go and support them through either social work or nursing, physicians, psychiatric care if needed. And then in addition to that, we have a seniors health clinic, which is just in the downtown core. And it's 3 massive apartment buildings with seniors who are low income. And at the base of one of the towers is our seniors health clinic. And our seniors, it's amazing. They come down in their jammies and see their doctor. And honestly, it absolutely warms the cockles of your heart, because they're just like family. And so we help them out with groceries and connecting and finances, as well as their health needs. But I think what we're most known for is our buses. It's our mobile fleet, and that's where TELUS has been a huge supporter of the Alex. So we have 3 buses that go out into the community. We have a dental health bus that sees students in grades 2 and grade 6, and they do all of the preventative care and cleaning of students who typically wouldn't get access to dental care. And in addition to that, we have 2 health buses that are our pride and joy, no pun intended.
Right.
We have a youth health bus that goes to our high schools, and so they predominantly deal with students, and it's episodic care, mostly mental health, a lot of mental health. A lot of the kids getting on the bus have real mental health issues and challenges, and are looking for that somebody to connect with. And our staff on the buses do that.
Joy, I mean, listening to you guys do a lot, and you are in constant contact with people. And now we're in a situation where we are being asked to self-isolate. We're being asked to, not be face to face, not leave our homes, and that's easier said than done for a lot of people. So how are we making sure that our seniors, like you mentioned, living in those buildings, how are we making sure that they are okay without, risking anybody's health with this virus?
So we've really had to pivot what we do and how we do in a very, very short order. What we're trying to figure out is, how do we stay connected when we're supposed to stay apart, right? And so what we've done at our clinics is we've tried to do as much online and remote care as possible. But what we hear from our physicians is there's still some clients. And one of the physicians said to me, we're doing about 70% of our work remotely now. So they're making phone calls, they're doing virtual care with clients, but some clients, no matter what, they really actually still need to see the physician. And so those folks, we still have our doors open at our clinics, and we're allowing those folks to come in. But what we're doing is we're taking all of the protocols and the guidelines that have been provided to us through Alberta Health Services. And so we're screening up front when any client comes in our door. We ask the 4 questions. Have you been outside of the country? Have you been exposed to somebody with COVID? Do you have a cough? Are you experiencing any symptoms? And then what we're doing is we're doing a thermometer check to see what your core temperature is. And if there's any concerns with any of those, then what we're doing is we're rerouting people. If there's not, like, for example, this morning when I walked through the clinic, even our staff are doing all of that pre-screening as well. So I walked in and there was one of our clients there sitting and waiting. And some of the staff were giving, we're having, we're joking around and trying to lighten the mood. And so I said to our client, see, I'm the boss, and they still check out to make sure that I'm safe to come in the building. And so then he kind of joked and said, well, what's the magic number where I'm not allowed to come in the building? And so I turned around to our nursing staff and I said, so what's the magic number? They're like, we start to get nervous if your number gets up to close to 38. And then of course he's like, what was my number today? And he's like, oh. And so they were like, you're 36.6, sir. And I was like, oh, that's what I just got. I said, you can't. I said, we still need to serve you today. So it was that sense of relief.
Right.
It provides us, right. So it provides a sense of relief for clients, and it provides a sense of relief for our staff as well. So that's the way that we're doing things differently. In terms of
I was just going to say, Joy, that, for a lot of nonprofits, that don't get government funding, that, they're the only way they survive is, and provide services is through fundraising. And I mean, you have a lot of experience in the nonprofit world. And I'm just wondering, do you have any advice to those smaller nonprofits that are providing services that are really struggling right now?
I can only speak from a Calgary perspective, and I was actually on a call this morning, and so I'm part of on behalf of the Alex, a collective of other nonprofits, and we actually meet online and have conversations. Well, usually in person, but today it was online, and we talk about different avenues for funding. And it was ironic because I did get a call from somebody today asking how they could access certain amounts of funding. And I'm happy to share different avenues to look at different funding, because I look at it this way: we're all in this together. While we have a robust set of services that we deliver at the Alex, we can't do it all. And we rely on community partners to do other aspects of this work. And so if I can share something with somebody, I'm happy to do that. Locally within the city of Calgary, there's a few different ways in which people can access. So Family and Community and Social Services, they've got a stream of funding that's available. The United Way also has a stream of funding that's available. And they're trying to ensure that those services that are that there's a gap for, that those pockets of funding can then be delivered to that organization to actually help them assist with clients.
Right, I mean,
yeah.
Right. Yeah, it's really, and like you said at the beginning, these are uncharted, territories, because we haven't done this before. And it's really hard, especially, people living in poverty. This is, life is hard without a pandemic, and now we have this added in, and it's creating a lot of stress and anxiety and fear. I'm getting a lot of that from people I know that use services. And Albertans they've been through hard times before. I'm thinking of the flood. And how Albertans, supported each other. And are you starting to see that? Are you seeing that reflected now?
I'm seeing it, but I'm seeing it differently. When the flood happened, it was isolated into certain parts of the city. And so Calgarians could come together and support the area in which the flood did major damage. And so those who weren't affected could pitch in and roll up their sleeves and dig down deep and do that. This is affecting everybody all across the entire world. So we're trying to figure out within the nonprofit sector who needs that support, how they need it. And so the things that I know that are what we're getting requests for specifically is for food and mental health, and accessing those financial support systems that have been made available by either your local provincial government or from a federal government. And so our staff have become experts on how to help navigate somebody to go online to fill out an EI report, or how to go online and fill out the emergency response that you can access through the federal government. And so we're all helping take care of one another. What we're seeing from some of our staff is that our staff are now working remotely. So now they're trying to figure out how do they work remotely but still support their clients. They're worried about an aging parent who might be living in a care facility. They also don't have any childcare, and now a spouse may have been laid off. And so how do you make all that happen but still support somebody else in this? And I think what I see from our staff is regardless of all those things that are happening, they're still stepping up and they're still supporting and they're still helping out. And so that's the power in terms of this, is that it is, for lack of a better word, it's become the kind of great equalizer from all of us, is that nobody is immune to this. There's no magic pill or potion that you can take to prevent you from getting COVID, and that we all need to do our part. And so, that's what we're seeing at the Alex. It's really been a testament as to who steps up and helps out.
Yeah. Do you think that when this is all over, this will change us?
It's what I think about when I go to sleep at night, is like, what is our new lived reality? I wonder about this new virtual platform that we find ourselves. I put out weekly blogs for our staff, and I said, so help me God, I will never do another teleconference after this is done. But then if that's my stand, I don't know how others are going to feel as well, right? So I like to be connected, and I like interactions. I love visiting with staff. I love visiting with clients, and I love visiting with our partners. And I enjoy the face-to-face, but I do wonder, like, the longer this keeps up, will this be our new norm where we interact with each other virtually? I don't know. I don't have the answer to that.
I don't know either. I've also been thinking about how, this crisis has highlighted or amplified what many of us already know, right? How people in poverty live. Yeah. How unbalanced things are for people in our community. And I'm hoping, because I'm like you, I think about it a lot, right? Especially at night when I'm laying there and I'm thinking about how is this going to change us? How does it change the way we deliver education or healthcare or all of these things, right? Friends, I feel like I'm talking to my friends more than less, just online and stuff. But I also wonder if we can finally, we're hearing so much about seniors. We're hearing more about, well, as far as I'm concerned, not enough yet about people with disabilities and the challenges they face. People living in poverty. And I'm hoping that we find a greater compassion, a greater empathy, a greater understanding for the people that are most vulnerable to a virus like COVID-19. Do you know what I mean?
Yeah, and I think that's one of my biggest hopes coming out of this as well. I think there's also going to be an appreciation for healthcare, right? And not just in locally, but globally as well. The only solution to this pandemic is health, and it's a healthcare solution. And so sometimes I really wonder, because we always just take for granted that if we need healthcare, especially in this country, that'll be available. And so daily we hear about like how many people are in the ICU, how many ventilators are left, what's that going to look like? And I know in this province, like we're getting an update from our premier today to say like, what is the outlook looking forward, going forward for Albertans, and what is that? And so it's all those great unknowns. And so I'm hopeful that with all of this, there's a newfound compassion, a found empathy for mankind in general, and that we, all walk this earth together. And so I'm hoping that there's also, more understanding about the earth and all of those pieces, right?
Do you think we could have been prepared for this? Do you think like nonprofits could have seen something like this coming or been able to be prepared in any way for something like this?
I'm hoping that this is going to, like one of our biggest learnings was that we hadn't invested as much in technology as we should have done. And so we had to literally scramble overnight to try and update our technology platforms. We're thankful to TELUS because TELUS had put it where our doctors and physicians and all of our healthcare professionals use the EMR system that we use is Wolf. And so we needed the virtual platform. And so that got built as well by TELUS, over a weekend. And so we're road testing that tomorrow. And so it's caused us to think about how we do our business. What is our core business? What is our essential business? What can we do without? What can't we do without? And I think in terms of could we have been more prepared for this pandemic? I've done a lot of reading and a lot of researching and looking at, Center for Disease Control, books that have been written, and that this was predicted. They said that there was going to be a pandemic that was going to hit the world and that we wouldn't be prepared. And it's sad when you read that thinking, my goodness, why didn't somebody pay attention to that?
Here in BC, Joy, we know that the big earthquake's coming and most of us are not prepared. So, I mean, it's just kind of the way we, as humans, we sort of maybe protect ourselves emotionally. I'm not sure. I'll have to talk to a psychiatrist about that and see what they say. How can people help in their community, whether it be, Calgary or Winnipeg or Toronto or Prince George or Vancouver, wherever you're living in Canada, wherever you're living in the world? What's a way that we can safely support people who are homeless in our communities, or people who, are seniors and living alone, or disabled and living alone? What are some things that we could do?
I think there's some simple things, and I think there's some really complex things. So in terms of the simplicity in this is people donating if they have the financial means to do that, helping out a neighbor. So for example, a simple thing, like we're fortunate because my mother-in-law lives in town. So my husband, and she's an elderly lady. And so my husband is the one who's doing her grocery shopping. He's not visiting with his mom because he's concerned about it, but he takes the grocery list, right? He goes and buys her groceries and he drops them off at the front door. But it's simple things like if you have a neighbor that you know that is isolated, doesn't have family, doesn't have connections, you can go on and go and support that individual. If you don't have somebody that you can support, I think there's other ways in which that you can help out and make a difference. And it's the simple things like I look at our healthcare workers and specifically those at the Alex, and you hear it time and time again where healthcare workers are saying, I'm going to work for you. So if you can stay home for me and protect my family, I think that's so critical in this time, in this pandemic. And I think it seems like such a big sacrifice, but I think it's a big sacrifice for a long-term win at the end for all of us.
And I'm sure you, there are a lot of single parents out there that are trying to earn money, or maybe they've been laid off, or they're also trying to keep their kids,
entertained and engaged with school.
Learning and engaged. And it's very difficult. And, it's overwhelming for a lot of people. For single parents that are struggling right now, I was thinking if I had to be getting diapers and stuff right now, this would be really challenging. So are there any ways that you can think of that, helping out? Like, how do we even know where to find? Is it a matter of just us reaching out to a nonprofit and saying, is there anything I can do to help you? Is that?
I think that would be. I think it'd be exceptionally helpful for us. We know who our clients are. Like we can tell you who our clients are, and so we're reaching out to them. I can give you a perfect example. We had a single mom with 4 young kids, and so she was sick. She wasn't COVID positive, and neither were the kids. They had a stomach illness, and so we knew that she needed help. And she said, "Look, I'm running out of diapers. I'm running out of food." So we said, "Tell us what you need. We'll go get the groceries for you, and we'll drop off." And so one of our staff literally went, got the groceries, went, knocked on her door, dropped off the groceries, and then we'd instructed this mom not to open the door so that she didn't, pass. We're not passing anything back and forth. Our staff member got back in the car. She opened the door, got the groceries in, and waved, and all the kids were at the window waving and saying thank you. And it was a deed such as that. It made a huge difference for mom and these 4 little kids. But it's an easy thing to do where you can just help out your fellow man.
I think, and sometimes, Joy, sometimes people don't know how to help.
Yeah.
And sometimes we need to be told how we can help. And I'm sure that, if somebody called the Alex and said, how can I help?
My team would help. There's no doubt that my staff would tell you what we needed. That there's no doubt.
So maybe there's what we can all learn from this, from our conversation, Joy, is that if you want to know how to help, just ask somebody, and absolutely. I'm sure they'll tell you. Yeah,
absolutely. Yeah.
Amazing. I really appreciate you. I know you're busy. I know you have a lot on your plate, and I really appreciate you taking the time to talk to us and letting us have a little peek inside of what life is like for you in Calgary right now while you're with the Alex and helping others. So thank you very, very much.
You're welcome. Always happy to share our story here at the Alex. So proud of our team.
Yes, you should be. Thank you so much, Joy.
Okay.
And be sure to visit their website, which is thealex.ca. And be sure to join us here on TELUS Talks with Tamara Taggart every Tuesday and Thursday.